Hi, everyone. This is Nicole Jorwic, the Senior Director of Public Policy for the ARC of the United States. Before I start today, I feel like it would be inappropriate not to acknowledge the unrest and sorrow that is going on in our country right now. The ARC of the United States and the disability community are in solidarity with all those who are fighting to ensure that what comes out of all of this is a more just society. We will work along organizations with the expertise and experience to do so, and lift up their voices. Given the events of the past week, it is hard to remember that we are also still in the midst of a pandemic. COVID-19 continues to be on the rise in several states, and some states are beginning to figure out an attempt to figure out what it looks like to begin to reopen. But the needs of the disability community in the face of all of this remains the same. Senate Majority Leader McConnell announced last week that a fourth package would be the last, which actually is a positive because up until then, publicly, he had been wavering on whether or not there would be a necessity for a fourth package. However, the timing of that package is still unknown. We're really hoping and pushing for action before the 4th of July holiday. It is possible that this will go into July, but we're really hopeful that we can get this, get the fourth package passed in the Senate because we know how needed the funds and the asks for the community are. As a refresher, on May 15th, the House passed its fourth coronavirus package, the Health and Economic Recovery Omnibus Emergency Solutions Act, or the HEROES Act, and that's HR 6800, with a vote of 208 to 199. The package included many of our priority asks, including increased federal funding for home and community-based services under Medicaid. And again, this was done through an additional FMAP, or federal match, of 10%. So 10% of all the state's Medicaid programs would then be directed specifically to support the Medicaid home and community-based services systems from service providers, the workforce, and providing the needed services to people with disabilities. It would also expand eligibility for the economic impact payments to adult dependents and funds another round of payments. It has paid leave eligibility for family caregivers of adults with disabilities, including siblings and parents. As we've discussed in past weeks, this is really important that we have a broad definition of what family caregiver means. The bill passed over 2 weeks ago, and so far we have not seen any motion in the Senate. We're not even sure if there's negotiations that have begun. This means that we have to push. There is a chance that the Senate will act before the 4th of July again, as I said, but only if they feel the pressure. So I want to give you 2 action steps. Reach out in some way to your senator and senators, both of your senators, any way that you feel comfortable. Tweet, call, email, call a local office, call the district, call the state office, call the DC office, ask them to include dedicated HCBS funding in the Senate package, and remind them that they must act now to serve their constituencies in the next COVID-19 package. The second one is to reach out to 3 family members or friends. It can be in your state, it can be in another state, and talk to them about why these issues matter to you. Once your federal advocacy towards the Senate is done, please take good care, stay healthy, and stay safe. We'll continue to push in Washington, D.C., and it's so heartening to know that all of you are pushing in every state, especially in Arizona. Thank you so much, and be well.